all the stakeholders were all there, including the Honorable Minister, including the Minister of Labour, National Salary Income and Wages Commission Office, or Head of Service of the Federation. And we have agreement on all these items that brought us on the welfare of our members, which include the restructuring of the residency training program. This program is the program that is responsible for ensuring that Nigeria will produce the specialist doctors that are responsible for taking care of the special medical needs of Nigerians. And if this program is not running very well, as it is running currently, that means in 5 years to come, we may not have specialists who are competent enough to take care of the medical needs of Nigerians. And then there are also issues of enrollment of doctors into the IPS platform, that is Integrated Payment Payroll Information System. Yes. Because at the moment, our resident doctors are being paid from the GIFMIS platform, which is not properly regulated, encourages a lot of leakages, and is overburdened with a lot of extra expenditures which are not supposed to be carried on that GIFMIS platform. And since 2013, we've been engaging government, asking government that we should be enrolled into the IPS platform. This we've been taking through series of advocacy, a lot of promises, and up to the 2nd of January, we still had promises. We also had the issue that have to do with our pension deduction. We have a Pension Reform Act of 2014, and that Pension Reform Act stated categorically in Section 3, those that are qualified to participate in the contributory pension scheme. And those that are qualified is any employee in government, federal government, state government, federal capital territory, and local government. It did not make any distinction into or any separation of government workers. It said any employee is eligible to participate in that contributory pension scheme. If we go down to Section 5 of that Pension Reform Act, we have those that are exempted from participating in that contributory pension scheme. And they include the judiciary and the members of the intelligence and armed forces, the SSS, and then the police, the military, right? But unfortunately, PENCOM, which is the authority and the institution established by law and by that act to ensure that pension is properly done according to that act, has not lived up to her responsibility. In 2014, when we had this issue, the Chief Executive of Tertiary Health Institutions, we are not deducting for our members. PENCOM had written them and directed them, referred them to relevant sections of that Pension Reform Act. Unfortunately, another director in PENCOM wrote another counter-directive, probably as an act of conspiracy, and now told them again that we are not pensionable, that he has investigated and the budget office is not budgeting for our own government counterpart funding. So we started asking, who is in the better position to direct each other? Is it PENCOM, who reports to the presidency, and who is supposed to be in charge of pension, giving instruction to a budget office, or budget office giving instruction to PENCOM? And that aspect of that Pension Reform Act is supposed to be deducted by the Attorney General of the Federation. I
will come to the issue of tertiary institutions, yes, but let's look at this. You shelved this ongoing strike like 3 times in 4 months, and there's been several threats on this planned, on this strike, ongoing strike. But why exactly do you think the government is not interested?
Honestly speaking, it's not even 3 times or 4 months. These issues have been lingering since 2013.
Exactly.
And each time we demand for these things to be implemented, the public will cry, and out of public sentiment and sympathy, we will go back to work, because we are not demanding to go on strike. We don't want to go on strike because we want to punish the people, no, but because we want the right thing to be done.
So in spite of the threats and even the shelved strikes, and now you're even going into, a full-blown strike.
Yes,
you've begun the warning strike, yes, and sir, you're planning an indefinite strike sometime in the near future. Why do you think the government is not placing premium on all of these demands?
Unfortunately, I would say it's misplaced priority on the part of government. The Federal Ministry of Health has not lived up to her responsibility. And the Director of Hospital Services with Director of Human Resources in the Federal Ministry of Health are involved in this complexity. They've not done the things they are supposed to do to ensure that these problems are sorted out.
Let me remind you that because you talked about infrastructure, the government really spent about 18 billion naira on upgrading primary health care centers. The president also launched the remodeling of the 10,000 primary health centers. And in addition to that, the government is planning to spend 11.7 billion naira on the upgrade of tertiary health facilities in the 2017 budget. Does this mean nothing to you?
That is part of what we are talking about. Primary tertiary health institutions is part of the misplaced priorities we are still talking about.
How do you mean?
10,000 health centers initially were supposed to be built in Nigeria, where we have over 15,000 primary health centers in the country, loitering about in the country. There are no manpower, no personnel to manage. The buildings are all dilapidated, and if you visit there, it's an abandoned structure.
But the government is beginning with 10,000. Isn't that something, a significant step?
We're referring to renovation or the building of new ones.
The rehabilitation.
Fine, that's important. Now, let me take you again to an issue. Most Nigerians don't even visit these primary health care centers. Most Nigerians access services at the tertiary health institutions. That is one problem. Now, when we rehabilitate these primary health institutions, who are those to man them? Will those primary tertiary health institutions, will they have the capacity to provide the services they are supposed to provide?
Did you say most Nigerians don't visit primary health centers?
Most Nigerians, even in the villages that we have today, most of them come to the tertiary health institution because inside the tertiary health institution, you have the primary health care facility also in tertiary health institution. A tertiary health institution comprises both primary, secondary, and then tertiary services. Now, we are also saying, as much as government is paying attention to these primary health institutions, which will enable decentralization so that we can focus on tertiary health services and then have these primary health institutions function the way they are supposed to function, then government should also pay attention to these tertiary health institutions that would prevent medical tourism.
But you understand the primary health facilities are closer to the rural people.
Definitely.
Rural communities, right?
Definitely.
So why do you say people don't really pay attention, people don't visit the centers?
Primarily because most of these primary health institutions are dilapidated. And if we also get them rehabilitated, we need people to man them. Now that takes me to the next important issue, which is the National Health Act. And it's also part of the reason why we are